Hey, this is Linda with TWC Pilates, and I just wanted to hop on and just give you an overview about what the Rehabilitation and Movement Program is about and why clients get better in 5 sessions. I have had clients come in and they have had chronic shoulder pain, chronic hip or back, sciatica for months, and sometimes years. And once we get to the root cause of what is causing this chronic pain or this acute pain that's become chronic, then we can start to help you in living an active, pain-free life for a lifetime. And part of what involves there is that having confidence that your body can support you in any activity that you participate in. So this was my goal as someone who has been moving bodies for her entire career. One of my frustrations is when clients come in and I check in with them. We're about to start one of our small group classes. How are you? And they go, I've just got, I've always got this neck pain. It's just like all my stress lives here and my neck is always sore. Or, that right shoulder, it's just always sore, and they move it really sort of funny and awkward. So my goal is that we get your body back moving the way that nature designed it to, and therefore you will be moving in a place where you feel strength versus strain. You're moving in a way that you have confidence that your body can support you and that you feel good. I'm 56 years old this year, and I don't plan on slowing down anytime soon. And the tools that I bring into this rehabilitation and movement program are the ones that I use on myself and that I've used on clients for my 30 years in practice. And there's a reason that it works. So I just want to take a look here at a traditional treatment program and what can happen when you go and see another person who does another modality, is that you go in, they do a treatment. Some of these appointments are really quick, and they just do their little thing, and you say, well, when should I come back? And they're like, oh, whenever, I don't know, just see how you feel, and well, give me a call if you want to book again. And so you walk out and you're like, okay, well, I feel a little bit better. I feel like I'm a little looser, a little less pain. And then sometimes within just a few days or a week, you're feeling that pain. You're back where you were, and then you go back again. Same thing. They do their treatment. Well, when should I come back? And they're like, well, whenever you like. So part of my challenge with that, if I am a client in that situation, is that I really want the practitioner to take control of my healing. They're the expert, they're the pro, and I want to know that there's a plan or a program. Have they done a full assessment? Have they mapped out some sort of plan that's going to help me to get better, and map it out in a way that they can articulate it to me so that I'm part of this process. So what I've done is in my rehabilitation and movement program is I've actually created it as a client empowerment program. And what that looks like is that you come in for a treatment, but in between each treatment, you are given exercises or a home practice through the use of videos that you're to do daily. And whatever those exercises are, I've taught you in our session so that you know how it feels. You've heard my cues, you've felt my tactile feedback, so that when you actually do it at home, then you know what it's supposed to feel like, and you're understanding the languaging and the cues. So the critical piece of this, and why these 5 sessions help to heal you so well, is because you're actually doing treatment every single day. I have a YouTube channel that I've set up, and if I haven't already done a video for the specific exercises, I will make you a video. So as much as I've created certain videos that I know work to bring core stability, work to improve breath, if there's something specific that I want you to do that's special for you, I will be creating a personalized program through video. So what you can expect in our 5 sessions is, first off, a full assessment in history. I want to know when you fell out of a tree and landed on your tailbone at 9 years old. I want to know about that. I want to know about your surgeries. I want to know about past injuries that you've had. I want to see your posture. I want to look at your alignment. We do movement screens, so we can look a certain way when we're standing, but what happens to our alignment and our stability and our control when we start to move? So we do movement screens. I do muscle testing to find out, is a certain muscle become inhibited, or in other words, it's not activating because another muscle has perhaps taken over and become a compensatory pattern. So if you aren't assessing, you're guessing. So you can expect a very thorough assessment. I'm not just going to look at what hurts. I am going to look at all of your body, because where the pain is usually not where the problem is. So we've got to look beyond the problem to, jeepers, I'm getting tongue-tied here. We've got to look behind the pain or beyond the pain to find where the problem is. You can expect some hands-on therapy. I do lymphatic treatment to reduce inflammation, improve fluid flow through the body. I work on improving circulation and vascular flow, which also helps to bring oxygen and nutrients so the body can heal. It helps to mobilize the tissue. So when we do some movement, the body's ready to accept it. You can expect some mobility of 4 key pressure zones. We work and do some release work around here. This is a key area that needs to be able to move around the collarbone and the back, underneath the ribs, and around the pelvis. Those are 4 key areas that if they're not able to move independent of the parts above and below, then there's going to be restrictions in your body. We also will do some trigger point body work. So if we've got some muscles that are overactive, then I get in there hands-on and I do some release work. And you can always expect that there will be movement in our sessions, because if all we do is release tension in the body and we don't give the body somewhere else to stabilize, this is where we always revert back. We might feel good for a few days and then we revert back to the way we were, because the muscles in the body goes, well, I don't know where to be stable now. And so everything just kind of grabs and hangs on and gets tight again. So we have to give the body a new pathway of stability, such as that we can keep that mobility that we've established there. And then finally, but one of the most important, is your home practice. What you do in between the sessions is going to make the difference. So if you aren't prepared to do a home practice or be coming in and doing some of our Pilates classes or something in between that solidifies what we do in those sessions, those results will not be as profound or as quick. So the home practice is key. I send you an email the next day. I say, how are you? What's going on? How are you feeling? Here are the videos that we talked about. I remind you of the tips. So there's support in between the sessions of checking in and seeing how you're doing. And I want that feedback back. I recently had a client give me some feedback and she said, oh, you know, you're probably getting sick of these emails. And I'm like, no, you're actually being the perfect client, because you're informing me of test results. You're informing me of how you're doing, because it helps me to formulate and fine tune and tweak the program that I've created for you. So I hope you find that helpful. If this is something that you think would be beneficial, then I look forward to working with you. And you know, hopefully that brings some clarity as to what sets apart this rehabilitation and movement program from maybe something else that you've tried. So thanks for watching. And if you have any questions, just send me a note.